Hello, everyone, and thanks for joining us for today's discussion on chemical dependency. My name is Jillian Parker, and I am joined by Dr. Linda Clark, specializing in preventative and occupational medicine, as well as Janice Leonardi, the Director of Chemical Dependency. Ladies, thank you for joining me today.
Thank you. Sure.
Now, today's conversation, again, it's surrounding chemical dependency. Much of the state is on pause due to COVID-19, but that statement doesn't remain true for those battling addiction. Addiction isn't put on pause. In fact, the number of overdoses in Monroe County are up from where they were this time last year. So for anyone who is battling addiction, who needs help, or anyone watching who might have a friend that may need help, just know there are still treatment options and recovery programs out there that are available. It's part of an essential service. And we want to make sure you're aware of all the options that Rochester Regional Health is providing. One of those options, brand new, we're going to talk about that in a second. But first, Janice, I have a couple questions for you, especially now during the COVID-19 pandemic. So many people are cooped up at home. The last thing anyone would want is to see someone take a step back in their recovery process. So why is it so important, especially right now, to be having this conversation?
Yeah, it's a really good time to talk about this right now because many of the factors that are known to jeopardize recovery are really prevalent right now. And if you're someone who's struggling with substance use, it's really important to have a plan to stay safe for the duration of this epidemic.
Do you think there's any rhyme or reason? Why are we seeing an uptick in overdoses since the pandemic began?
It's reasonable to think that many people are feeling isolated. And for people who are also struggling with substance use, these people are cut off from their social supports. And those are the main things that help people to stay in recovery.
iMac is new, and we're going to talk about that in a second. But first, Janice, can you tell me about what support is already out there that Rochester Regional Health is providing for those who are battling addiction?
Sure. We pulled together a special program, actually, that is focused on building the skills in the moment that are most effective in maintaining recovery during a time of crisis. This includes telephonic and video groups on topics such as symptom management, stress management, recovery supports, return to use prevention. We have a lot of these skill builders right now. And because we didn't know what people are actually dealing with out there, it was important for us to give them some choice in the topics and the groups that they would like to attend and the frequency for which they like to attend them. So a person could simply attend one group and be okay, or they could attend every group every day.
If someone was to decide that, come to terms with the fact that they needed help, what's the first thing that they would need to do to get involved?
Yeah, it's actually much easier to get involved right now because the entire process can be done right over the phone. So there's no need to drive anywhere or get a babysitter or get on a bus. You can simply just call. And if you let us know that you are in crisis or if you really wanted help, we can make sure that you start receiving services that same day. So really, it's just as simple as a phone call.
Now, both inpatient and outpatient recovery options, what is being handled differently since the pandemic began, and how has technology been playing a part?
In many ways, we are still operating full steam, providing all of the services that we did before COVID-19. However, some of those services are being delivered differently, so to speak. So on the outpatient space, we are seeing many people telephonically and by video. However, we're still seeing people in person when they're at high risk or it's clinically indicated that we need to see them in person. We're still bringing them in to understand their risk and help them stabilize and provide medication and so forth. And the inpatient and residential spaces, we have reduced the number of people that can be housed at one time. We've also restricted and modified the flows within our buildings so that there aren't as many areas where people are congregating. And additionally, we're providing personal protective equipment to everyone in the buildings. And we're also cleaning and disinfecting multiple times daily to make sure we do everything that we can, because those people really need to be in residence.
Awesome. And Dr. Clark, I want to head over to you for a second and talk about iMac. Break it down for me and for everyone who may be tuning in. What does iMac stand for? What is it and what does it offer? I know it's new and you felt this was important to get off the ground, you said sooner rather than later, especially during COVID-19.
Right. iMac stands for Integrated Medication Assisted Treatment. And it's a way of utilizing medication to help people who have substance use disorders. We mostly focus on opioid use disorders, but we know that doesn't travel by itself. So we also look at other substance use disorders as well as mood disorders that obviously can influence substance use. The real special part of the program is the comprehensive nature of it. So we are housed in primary care so that it kind of normalizes the way you manage your substance use disorder, just like you manage your high blood pressure and diabetes. But we're connected to so many vital services in our system, like Jan's Chemical Dependency program. So it's a real comprehensive way to manage substance use disorders while giving patients the flexibility to at least start their treatment in a environment that's more comfortable for them. We call it a hub and spoke model. So we here at the Wilson Health Center are the hub, and all of our spokes are all those primary care practices that also prescribe medications like Suboxone, buprenorphine. We support those primary care practices doing that, but we're also connected to vital services like chemical dependency, emergency room, so that the patient has a seamless experience within our system.
What makes this program different, and why is it that you did feel it was so important to get this off the ground now?
Right. Now, I've been, treating opioid use disorders in private practice for probably almost 15 years. But it's it's a very isolated experience, and it's very hard to get my patients connected to vital services like behavioral health that are so important for long-term recovery and success. So we've been working at this program for a while, but like we mentioned earlier, seeing the uptick of opioid overdoses in our county, that indicated we need to have more options, and we need them now. So we accelerated some of our plans to get people in and seen and treated as soon as possible.
What are some of the common medications that are being used?
Okay, so everybody talks about Suboxone. The generic name of Suboxone is buprenorphine mixed with naloxone. So the buprenorphine it's an opioid medicine itself. It's a very strong opioid medicine, but it can block other opioids. And when I say opioids, I mean medicines like Percocet and Vicodin, oxycodone and hydrocodone, hydromorphone, those medications that are prescribed, but also opiates, those natural opioids like heroin and morphine. So this medication works to get rid of any cravings for opioids, and to kind of make you feel normal. It's not intended to make you feel high. It's just to get you to normal. And a lot of my patients work and take care of their families and kids and all that, and this medication helps them to work out all those other issues that need to be worked out for a successful recovery. So there's other medications that we use as well. You may have heard of Vivitrol, which is kind of like our naloxone, it's naltrexone, and it can be given by mouth or it can be given by injection. And that medicine was originally developed for alcohol cravings and alcohol abuse, but it's found to be wonderful with managing opioid use disorders as well. So when somebody doesn't want to be on an opioid anymore, but still needs something else to help fortify their recovery, Vivitrol might be an option. But we use other medications as well, depending on what people come in with. You know, if they have some depression, we wanted to help manage that. You know, if they have some anxiety, we might help manage that. But always knowing that we have the support of our behavioral health program and our chemical dependency program when things get more complicated.
What are some of the options after someone were to use medication and still need further help?
Yeah, well, yeah, I never wanted to say that medication is more important than the other parts of recovery. And I think while people are on medication, we want them to work to build all those other tools in their toolkit. So AA, NA, you know, those 12-step programs can be still very, very important to many people. The other programs within behavioral health, if maintaining your mental health is critical, it's key. So, you know, if you're seeing a therapist, that may be something that you continue to do after you're off of medication. And then just looking at all those other aspects of your recovery that you've been working on for the time you've been on the medicine. It could be church, it could be exercise, it could be, you know, maintaining your physical health. There's so many components to feeling well, and that's what's encouraged in recovery.
What is your goal with iMac?
Our goal is to make sure that people get what they need when they need it, okay? And I think we don't have some of the constraints that some of the other programs might have in terms of who can stay in the program. You know, for instance, if you just can't do group 3 times a week, we can still work with you for now. But our goal is also not to, you know, we want to meet you where you are, but we don't want to leave you, you know, where you came in. So, you know, we want to help you progress and to help you form the recovery plan that you want. So I like that part. There's some flexibility, and when we need more structure, we have more structure too within our health system.
I know you said Wilson is the hub. Where is it is that the only place people can go, or other places?
No, we have other sites we call hubettes, and then our primary care offices. Clinton Family Medicine with Dr. Akmashay has been doing this for quite a long time. So they're very central to what we do. And we don't want to minimize all those other sites that are working together, and we're constantly trying to put other places together so that they can provide these needed services wherever people are in our system.
Okay. And Janice, I want to ask you, just with everyone working so well together, everyone with their own programs, but they all tie into each other a little bit, how beneficial is it to have these other programs so close by within the one system, Rochester Regional Health, to be able to lean on one another when need be?
Yeah, I think that is a major advantage for a client because as Dr. Clark was explaining, people are in different places at different times in their lives. And at one point they might be highly motivated to, you know, come to treatment or, you know, to commit, and their circumstances in their lives are allowing them to focus on themselves. However, if they're not there or that doesn't work, we truly do try to find the options that also best work for them, and we partner with them, and there are many more options than people actually realize. And having one point, a single point where they can come in, and of course we need to evaluate for risk of safety and immediate harm. However, you know, we also want to partner with a person to give them the best recommendation and then support their decisions.
Now, it's not always just the patient. Well, the patient is treated, but a lot of times support is needed for that patient's entire family. What kind of support is offered in that sense?
Yeah, we, from the very start, we strongly encourage family members to participate right along in treatment. In the initial evaluation, we attempt to identify what's called a support advocate. And oftentimes it is a family member, but it does not have to be. And that person is identified, and their work options for them to participate are individual sessions with them, group sessions, education with and without their loved one. In our new adolescent program, we do intensive work with parents. We help them actually learn how to reset the boundaries and communicate with their teens. And we also teach them skills for and fostering change motivation. So we do really love it when we could have an advocate or a family member participate, because the likelihood of success and successful outcomes really increases when you have that support involved.
And because there are some different programs, different paths, depending on the patient and what their needs are, how do you best evaluate what path or which program or method is right for a certain patient? What are some of the factors that go into that?
Well, we begin with a comprehensive evaluation, and the first thing we are looking for risks, mental health and physical risks of suicide, risk of harm. And then after that, we are also factoring in the types of substances, the frequency of use, their home environment, their physical stability, their status of withdrawal, or other medical issues or mental health issues. So we do try to take a comprehensive look so that we can make the best recommendation for the care that they want. But as we were speaking before, we also attempt to understand what that person's goals are and their individual goals and their desires for treatment. And then we partner with them to figure out the option that's going to work the best.
What is the most important message that you might have for people who are looking to seek treatment, and maybe also people who could be on the fence a bit?
I would say that, again, there are many more options than you think, and nobody is going to try to strong arm you into something that does not work for you. Traditional rehabs or the things that you see on TV are not always today what are most effective, and we do have many more options for people, including those who only would like to stabilize that medication, and that's all they're interested in. We have options for people to do detox in their homes and continue their lives and their jobs. There really are a lot more than people think. So I would say to go ahead and call us and see what's available and what might work.
Dr. Clark, I want to ask you the same question. What would your message be to people also who may be looking to seek treatment?
To continue to have hope. I think that in times like these, it's easy to lose hope, and we are here to partner with you to maintain and sustain that hope. And like Jan said, in a way that works for you and with you, but also to help you move towards your goals. We're not going to just leave you to be where you've always been when you want to be somewhere else. I didn't really talk about our role as the hub for this program. You know, there's several entryways into our program, but you may come straight to us. I have a coordinator, iMac coordinator, Nancy, who will help us get you to the right place, help you move throughout the system. So you don't have to worry that you're going to be left to navigate this by yourself.
Is there anything I missed that either of you wanted to say, or any final thoughts?
Yeah, I would say that COVID-19 is teaching all of us more about behaviors, right? Behaviors that could help, keep us physically safe. And those things are washing your hands or wearing masks or social distancing, but they are also teaching us behaviors that can protect our mental health right now. And right now, for people who are in recovery or struggling with substance abuse, that is just as important. And those behaviors look like virtual connection, and they look like, building the coping skills to deal with whatever's going on right now in their lives. So I just wanted to say that both are equally important. And right now, my message would be to have everybody really think about that.
I think she sums it up very, very well. And I agree, medication is not the only thing that is helpful for managing your substance use disorders as well as your mood. And I think, that's what gets us a lot of us where we are right now is recognizing what's going on with our mental and physical health are very critical to being well.
Kind of having said that, what is the best method of contact to get involved? And I know because iMac is a little newer, where can people find more information, both on that, but also the existing recovery services as well?
Right. So we have a web presence, yay, and we can be found now under the umbrella of the addiction services that are offered, although we are nestled in primary care. You can call our program directly at 974-5513, and I have a coordinator and a fantastic experienced nurse that can help get you into our program, our iMac program.
And I would say that we also are a conduit for people who are interested in the iMac program. So if they call us, 585-922-9900 is our central intake number. And so you can call that. We also have information on the website, rochesterregional.org, under the behavioral health section. You'll find the chemical dependency services.
Awesome. Thank you both so much for taking this time today. I know it's so important to get these messages across and remind everyone that these programs are still important. As Janice, as you mentioned, mental health still just as important with everyone, a lot of people being isolated at home. So thank you.